One out of three women who deliver babies in Africa die because of blood was not available in the hospital when they were delivering their baby. I remember finding out this fact a couple of years ago and being really hit by the sheer injustice of it all. I believe that there is an epidemic around black birth the world over, in the diaspora in the United States, around women of color, and of course in Africa where I work. I think that birth is a human rights issue, and I think that sense of justice drives my work. I run a company called LifeBank. We work here in Kenya, in Nigeria, and in Ethiopia, delivering critical resources to hospitals where these women give birth. And what we're trying to do is make sure that the resources, the supplies, blood, oxytocin, that these women need to survive birth and to thrive and meet their babies, we make sure that they are in the hospital. So for me, it's a calling, and I think that it is a problem that we need solidarity across the world in tackling it and ensuring that black women who choose to give birth survive the birth and actually thrive after. The issue of birth justice is, very silent, in the continent. I get to work in three countries, three of the largest countries in terms of population on the continent, and this idea that women die in childbirth is a very silent matter. Of course, the people who suffer from it know it. They feel it. The horror and the pain and the injustice of dying and not meeting your child. But it's just the beginning. One of my commitments, apart from my job, is starting a process of public advocacy to get the word out about this epidemic and to get the right commitment, both monetary commitment and policy, and to just get the word out about this issue and ensure that we have this sense of solidarity across our continent, but also with the diaspora as well. For us, poverty, of course, is a huge factor causing this problem. A vast majority of people on the continent have to pay for healthcare out of their pocket. So if a woman does not have the resources to purchase blood and to get oxytocin and to pay the right doctor and to get to the hospital on time, then she actually dies from these conditions. So one of my commitments is to ensure that we build a system that works for everyone, because I believe that birth is a human right, and ensuring that all the resources that you need, or the supplies that is needed to save every mother is available, no matter how much she has in her pocket. Of course, there are many challenges that we face in doing this kind of work. It's not a popular problem to solve. It's not a problem that has critical mass of people really pushing. So it's basically making a case for why we need to invest in women and invest in birth and ensure that there is justice. So that is, I think, for me, a significant challenge. And I think a way to solve that is to build this global coalition of people who will commit to doing this work and create the resources that allows us to rescue women from a tiny village to a big town on the continent. COVID-19 came, there was a shutdown, it was a huge problem across the world. But those of us who do this work know that women are still having babies are still being born, and the work of ensuring that these women survive still is present. Of course, most of the blowback from COVID-19 affects women. So it's even more important to gain back some of the progress that we've made previously for women. Because when resources, when countries are struggling, the first thing they typically cut is, things that affect the most vulnerable. And it's important that those of us doing this work in the global community, advocate to ensuring that we gain back those progress that we've made on women's health globally. I come to this work because of a personal commitment. This personal commitment actually predates me becoming a mother. And I remember learning the facts about maternal health on our continent and feeling really struck by the sheer injustice of it. I left my very comfortable life in the United States and moved down to Nigeria to try to build a system to solve this problem. And that's what I've been doing. The journey became even more personal when I had my son 7 years ago, and being able to get pretty good healthcare in the US really became something that really inspired me to come down to Africa to do the work. And I'm just incredibly proud of what we've been able to do at LifeBank across 3 countries, rescuing women and building the systems, the health system that will allow us to ensure justice